Most people assume a heart attack happens because an artery gradually fills with plaque until it is fully blocked. That is not usually what happens, and the distinction matters more than most people realize. Understanding how plaque actually causes cardiac events changes how you think about what to do about it, and it leads directly to one specific, well-researched dietary compound that has 2 randomized controlled trials showing it reduces the most dangerous type of arterial plaque. Today, I am going to explain the biology clearly and then walk through the specific dietary and lifestyle factors that address it at the root level rather than the symptom level. How plaque actually causes heart attacks. There are 2 types of arterial plaque, and they behave very differently. Hard plaque is calcified. It is more stable, slower to change, and while it narrows arteries, it rarely ruptures suddenly. Most people who are aware of their calcified plaque and managing it appropriately are not in immediate danger from it. Soft plaque is unstable. It has a thin, fibrous cap, covering an inflammatory core filled with dead immune cells, lipid deposits, and calcium. This type can rupture even when it is only partially blocking an artery, sometimes at just 20 to 30% occlusion. When it ruptures, the contents spill into the bloodstream, triggering an immediate clotting response. That clot is what causes the heart attack. This is why a significant percentage of cardiac events occur in people whose routine tests showed only moderate blockage. The danger was not the size of the plaque, it was its composition and stability. A UCLA study involving over 135,000 heart attack patients found that 75% had normal LDL cholesterol levels. That finding points to something important. Cholesterol management alone does not fully address the mechanism that makes plaque dangerous. To understand what actually drives plaque formation, it helps to go earlier in the process, before the plaque appears. The innermost layer of your artery walls is called the endothelium, a single layer of cells that keeps blood flowing smoothly and prevents anything from entering the arterial wall. When this layer is healthy, it produces nitric oxide, which maintains vessel flexibility and blood flow. When the endothelium becomes damaged through chronic high blood sugar, smoking, oxidative stress from processed food ingredients, or chronic high insulin, it develops microscopic injuries. These injuries trigger an immune response. The liver responds to certain dietary conditions by producing small, dense LDL particles rather than the larger buoyant type. The larger particles do not penetrate the arterial wall. The small, dense particles do. They are small enough to embed in the damaged endothelium. Once embedded, these particles oxidize. The immune system detects them as a threat. Specialized white blood cells called macrophages arrive to consume them, but they cannot stop. They become engorged with oxidized cholesterol and eventually die within the arterial wall. This accumulation of dead immune cells and debris is what forms the core of soft plaque. The driver of excessive small dense LDL production is primarily excessive carbohydrate intake, specifically excess carbohydrates that the liver converts into triglycerides, which are then repackaged as small dense LDL particles. This is the upstream chain: excess dietary carbohydrates, row elevated triglycerides, small dense LDL, row arterial wall penetration, oxidation, immune response, soft plaque formation. Now to the specific compound with the strongest published evidence for addressing soft plaque directly. Aged garlic extract is not the same as fresh garlic, and that distinction matters for this specific application. Fresh crushed garlic has well-documented benefits for blood pressure and circulation, but the specific transformation process of aging garlic produces a different compound profile that has been tested against soft plaque in human clinical trials. 2 randomized controlled trials using aged garlic extract at 2,400 milligrams per day with angiographic imaging to directly measure plaque found that the treatment did not simply slow progression, it reduced the volume of soft plaque measurably. This is a meaningful clinical finding because most interventions tested for arterial plaque, including pharmaceutical ones, are evaluated on slowing progression rather than regression. Reduction in soft plaque volume is a stronger outcome Aged garlic extract also has documented moderate blood pressure lowering effects and antioxidant properties that reduce oxidative stress in the arterial environment. One important note: aged garlic has mild blood thinning properties. If you take any anticoagulant medication, including aspirin, warfarin, or newer blood thinners, discuss adding aged garlic extract with your physician before beginning. Beyond aged garlic, several other well-evidenced factors address the upstream mechanisms described earlier. Reducing dietary sugar and refined carbohydrates is the most direct intervention for lowering triglycerides and the small, dense LDL particles that drive plaque formation. This does not require an extreme dietary approach. Meaningful reduction in added sugar, white flour, and ultra-processed foods produces measurable improvements in lipid particle size over weeks to months. Magnesium plays a specific role in cardiovascular health that is frequently overlooked. It is a cofactor for energy production in heart muscle cells, supports healthy blood pressure, and helps regulate calcium deposition, which affects arterial wall stiffness. Research confirms that magnesium deficiency is associated with higher rates of arterial calcification. Most adults over 60 do not consume adequate magnesium from diet alone. Omega-3 fatty acids, particularly from fish or cod liver oil, have documented modest effects on soft plaque and more significant effects on triglyceride levels and arterial inflammation. Cod liver oil provides the additional benefit of vitamins A and D alongside the omega-3 fatty acids. Regular physical activity increases nitric oxide production, the molecule that maintains endothelial function and vessel flexibility. Even moderate daily walking has documented positive effects on endothelial health and blood flow. Intermittent fasting, eating within a defined daily window rather than continuously, reduces insulin levels and systemic inflammation, addressing two of the upstream drivers of small, dense LDL formation and endothelial damage. Standard cholesterol panels measure total LDL without distinguishing between the large buoyant particles that do not penetrate the arterial wall and the small dense particles that do. This means a normal LDL result does not tell you whether your lipid profile is low risk or high risk for arterial plaque formation. An advanced lipid panel, sometimes called an NMR lipid profile or LDL particle size test, measures particle size directly. You want to know your ratio of large buoyant to small dense LDL particles, your LDL particle number, and your apolipoprotein B level. If your total LDL appears normal, but you have a high proportion of small dense particles, you carry meaningfully higher arterial risk than the standard number suggests. If your total LDL is elevated but the particles are predominantly large buoyant, your risk profile is very different. This test is available through most standard laboratories and is worth specifically requesting at your next appointment, particularly if you have a family history of cardiovascular disease or metabolic syndrome. Here is what the evidence points to for addressing arterial plaque risk at the root level rather than only at the symptom level. For soft plaque specifically, aged garlic extract at 2,400 milligrams daily has 2 randomized controlled trials showing reduction in soft plaque volume. Discuss with your doctor before starting, particularly if you take blood-thinning medications. For upstream prevention, reduce dietary sugar and refined carbohydrates to lower triglycerides and shift LDL particle size toward the larger, less dangerous type. For ongoing arterial support, magnesium supplementation. If dietary intake is insufficient, omega-3 fatty acids from fish oil or cod liver oil, regular daily movement, and consideration of an intermittent fasting pattern to reduce insulin and inflammation. For measurement, ask your physician for an advanced lipid panel that includes LDL particle size, not just total LDL. A few things worth saying clearly. This video addresses dietary and lifestyle factors for arterial health. It is not advice to stop, change, or avoid any prescribed medication, including statins. If your physician has prescribed cardiovascular medication, that prescription was made based on your specific health history and risk profile. Any changes to prescribed treatment should be made in consultation with your doctor. The research on aged garlic extract is genuinely encouraging for soft plaque specifically. It does not replace the management of other cardiovascular risk factors. Blood pressure, blood sugar, smoking cessation, and weight management all remain important. And if you have been diagnosed with cardiovascular disease or have had a cardiac event, your physician's guidance takes priority over any dietary protocol. The biology of arterial plaque is more nuanced than most people are ever told. The dangerous type is not the largest plaque, it is the most unstable, and the conditions that create it are largely dietary and metabolic, built up over years of upstream choices that standard cholesterol management does not fully address. Understanding the mechanism changes what you look for in your lab results, what you ask your doctor, and what daily habits are actually worth prioritizing. Aged garlic extract, reduced carbohydrate intake, magnesium, omega-3 fatty acids, daily movement, and advanced lipid testing. None of these require expensive interventions. All of them have evidence behind them. If this was useful, share it with someone you know managing cardiovascular risk who has been focused only on the cholesterol number. And if you want more honest, evidence-based health conversations built for adults over 60, subscribe to this channel. We are here every week. Take good care, and I will see you in the next one.